Hey guys! Welcome to the Psychiatric Online Teaching video. So today, we are going to talk about Attention Deficit Hyperactivity Disorder ADHD. Do your children are hyperactive as for their age? Do they have trouble to wait for their turns or listening to what you say? Or easily distracted over things and have trouble to stay focused? If that's the case, then your children might have ADHD. But before coming into any conclusion, let us venture into ADHD for better understanding about this topic. In this topic, we will give some introduction to ADHD, discuss about the signs and symptoms of this disease, giving some explanation on the pathophysiology of this disease, which is how this disease occurs, and lastly, the treatment for ADHD and the mechanism of action of the drug treatments used. Attention Deficit Hyperactivity Disorder ADHD is also called as Attention Deficit Disorder ADD, in which ADD is with less hyperactivity symptoms. ADHD is a medical condition and one of the most common neurodevelopmental disorders of childhood and often lasts into adulthood. ADHD can also affect many adults. It can also be defined as general impairment in at least two settings, commonly home and school. Mean worldwide prevalence of ADHD in children and adolescents below 18 years old is 2.2%, while the prevalence of ADHD in adults ranged between 18 to 44 years old is 2.8%. ADHD is, however, most common in boys than girls. ADHD can be diagnosed as for three different types. They can be inattentive type, hyperactive impulsive type, and combined type. Combined type is the most common one for ADHD when the patient has both inattentive and hyperactive impulsive types. As for your information, there is no lab test can be done to diagnose ADHD. Therefore, the right way to diagnose it is by gathering information from the parents and teachers, filling out the checklist, and do medical evaluation as for vision and hearing process to rule out other medical problems. According to Diagnostic and Statistical Manual of Mental Disorders 5th edition DSM-5, the symptoms present must be 6 or more and have been present for at least 6 months. Signs and symptoms of ADHD. Young children are normally energetic, have higher activity levels, cannot sit still, and experiencing short attention span at one time. Unfortunately, kids with ADHD face those struggles harder, and the symptoms happen quite often that they might be mild, moderate, or severe. ADHD symptoms can occur at the age before 12 years old and could be noticeable as early as 3 years old. As I have mentioned before, symptoms for ADHD are inattentive, hyperactive, and impulsive. For inattentive, patients might have trouble focusing their attention, concentrating, and staying on task. They might not listen well to directions, seem to be forgetful and absent-minded. They may also lose track of their things. Move on to hyperactive symptom. The patients are fidgety, restless, and easily bored. They have trouble sitting still or staying quiet when needed, rush through things, and therefore make careless mistakes. They can climb or jump when they shouldn't. For impulsive symptom, they act too quickly before thinking, often interrupt, might push or grab, and find it hard to wait. They may do things without asking for permission and experiencing emotional reactions that seem too intense for the situation. Move on to the pathophysiology of the ADHD. How ADHD may develop? The answer to that is the exact pathophysiology of attention deficit hyperactivity disorder ADHD still remains poorly understood. With this said, several mechanisms have been proposed as factors associated with the condition. These include problems with the central nervous system, the genetic factors, and the environmental factors. For the first factor proposed, it involves the abnormalities in the functioning of neurotransmitters, brain structure, and cognitive function. For neurotransmitter, much research supports the idea that catecholaminergic systems mediate the onset and expression of ADHD symptoms. Due to the efficacy of medications such as psychostimulants and noradrenergic tricyclics in the treatment of ADHD, neurotransmitters such as dopamine and norepinephrine have been suggested as key players in the pathophysiology of ADHD. Dopamine is a specific neurotransmitter that gets released when the brain is involved with behaviors like motivation, taking a risk, and being impulsive. Norepinephrine is another type of neurotransmitter involved in attention, arousal, high alert, and memory. It is thought that lower amount of these two neurotransmitters floating around the synapse contributes to symptoms of ADHD. However, the reasons why these neurotransmitters might be down are still not well understood and research remains ongoing. ADHD also involved with the abnormalities in brain structure. Several types of study provide information about the locus of ADHD's pathophysiology in the brain. Taken together, these studies support the idea that ADHD arises from the dysregulation of frontal cortex, subcortical structures, and networks connecting them. These structures play a crucial role in regulating attention, behavior, and emotion, with the right hemisphere specialized for behavioral inhibition. Thus, individuals with ADHD are said to have impaired inhibition of frontal cortical activity on subcortical structures that might be due to deformations of the basal ganglia nuclei or slower rate of cortical thinning in the brain, which results in the difficulty to stop their responses and become more hyperactive. ADHD is also linked to some neurophysiological deficits and abnormalities in cognitive function. These deficits may usually be seen in the resting state brain activity, but may also involve the default mode network DMN activity, which is key in the region of the brain used to process tasks. As a result, affected individuals are likely to have difficulty in regulating and maintaining attention. Move on to the next factor proposed, which is the genetic factors. ADHD sometimes may be inherited or due to genetic predisposition. One interesting clue to a genetic component of ADHD is by looking at the families. For example, a child with a sibling that's been diagnosed with ADHD is more likely to develop it themselves. If those siblings are identical twins, meaning they have the same DNA, their chances of developing ADHD are considerably higher. As to a specific gene, there are studies that found that it's probably not one single gene that leads to ADHD, but rather multiple genes that determine how severe the symptoms are. These genes likely influence the production or regulation of the brain's neurotransmitters. Moreover, boys and men are more at risk of developing ADHD than girls and women. This could be due to genetic factors or hormonal factors. There are also some syndromes that are maybe genetically predisposed to developing ADHD. Children with Klinefelter syndrome, Turner syndrome, Fragile X syndrome, neurofibromatosis type 1, Williams syndrome, DiGeorge syndrome are at increased risk for ADHD. There are also, however, environmental factors at work in developing ADHD. Patients who are exposed to environmental poisons and toxins are at higher risk of behavioral problems. Notable among this is lead exposure from paint and pipes in old buildings that has been linked to short attention spans and violent behavior in some children. Some studies also have shown that pregnant women who smoke, take alcohol, or use recreational drugs are at a higher risk of giving birth to children who go on to develop ADHD. The exact pathology behind this association is not well known. However, it is speculated that this type of abuse in utero or within the womb reduces the neuronal activity by altering the nerve messenger chemicals. Moreover, if a child is being born prematurely before 37 weeks of gestation, being born with a low birth weight and severely neglected early in life will influence the child's behavior, thus increasing risk of developing ADHD. Children with acquired traumatic brain injury has also been linked to ADHD in some studies. However, the number of children who have suffered such brain injuries is too small to explain the rising prevalence of ADHD. So after understanding the pathophysiology of ADHD, here comes the problems. How do we treat ADHD effectively? ADHD management can be classified into two categories, which are the pharmacological and the non-pharmacological treatment. Choices of treatment would be dependent on the patient's age and condition to obtain the desired outcomes. When it comes to ADHD pharmacological management, we usually opt for stimulants, non-stimulants, and antidepressants. Medication can help children manage their ADHD symptoms in their everyday life and can help them control the behaviors that cause difficulties with family, friends, and at school. Meanwhile, some common non-pharmacological management for ADHD are behavioral therapy, psychoeducation, lifestyles, and diet change. Stimulants are the best known and most widely used ADHD medications. Between 70 to 80% of children with ADHD, it is observed that children taking these fast-acting medications show fewer ADHD symptoms. Common stimulants include amphetamine and methylphenidate. The possible adverse drug reactions that the short-acting stimulants can bring are loss of appetite, weight loss, heart problems, and psychiatric problems. Let's move on with the mechanism of action of stimulants. Methylphenidate with brand name Ritalin mainly achieves its effect by reducing or blocking the reuptake of neurotransmitter. The mechanism of action involves methylphenidate binding and blocking the dopamine and norepinephrine transporters altogether, so that norepinephrine and dopamine cannot be taken back up into the neuron. Thus, more of these neurotransmitters are available to act on the norepinephrine and dopamine receptors on the postsynaptic neuron, increasing the postsynaptic neurotransmission. For amphetamines, it mainly achieves its effects by increasing the release of neurotransmitters such as dopamine and norepinephrine. Amphetamine can promote the release of intracellular dopamine and norepinephrine into the synaptic cleft, and at high doses, it even inhibits monoamine oxidase, which degrades free dopamine and norepinephrine. It also able to block the reuptake of dopamine and norepinephrine transporters. Thus, more of these neurotransmitters are available to act on the norepinephrine and dopamine receptors on the postsynaptic neuron, increasing the postsynaptic transmission. Non-stimulants, on the other hand, do not work as quickly as stimulants. However, their effect can last up to 24 hours. Ethamoxitin, clonidine, and guanfacine are three common non-stimulants drugs. They are likely to cause fatigueness, upset stomach, dry mouth, and nausea. Bear in mind that medications can affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to one medication but not to another. Hence, medications should be personalized to the individual and closely monitored by a doctor. When medication for ADHD is not carefully monitored, it is less effective and become more risky. In the non-stimulants, ethamoxitin, a selective norepinephrine reuptake inhibitor, is used for treatment of ADHD. It achieves its effects by decreasing the reuptake of norepinephrine through selective blocking of presynaptic norepinephrine transporter. More norepinephrine will be accumulated in synaptic cleft and thus increasing the postsynaptic transmission of norepinephrine. Clonidine and guanfacine are alpha-2 adrenergic agonists. Centrally, they activate alpha-2A receptor located at postsynapse, which mediate the inattentive, hyperactive, and impulsive symptoms of ADHD. In addition, clonidine and guanfacine also stimulates postsynaptic receptors, which can increase norepinephrine signaling to normal levels. If the child doesn't do well with stimulants, that is when bupropion, which is a common antidepressant for ADHD, will be prescribed. Side effects often include trouble sleeping, nausea, constipation, dry mouth, sweating, and changes in sex drive. Imipramine, bupropion, venlafaxine are antidepressants that can also be used in treatment of ADHD. These three antidepressants involve similarly in the inhibition of norepinephrine reuptake by blocking the norepinephrine transporter. Bupropion can also additionally block the dopamine transporters together with norepinephrine. So when norepinephrine or dopamine cannot be taken back up into the neuron. Thus, more of these neurotransmitters are available to act on the norepinephrine or dopamine receptors on the postsynaptic neuron, increasing the postsynaptic neurotransmission. Medication can help reduce symptoms of hyperactivity, inattentiveness, and impulsivity in children and adults with attention deficit hyperactivity disorder (ADHD). However, medications come with side effects and risks, and they're not the only treatment option. The first thing to understand is exactly what medications for ADHD can and can't do. ADHD medication may help improve the ability to concentrate, control impulses, plan ahead, and follow through with tasks. However, it isn't a magic pill that will fix all of your or your child's problems. Even when the medication is working, a child with ADHD might still struggle with forgetfulness, emotional problems, and social awkwardness. Or an adult with disorganization, distractibility, and relationship difficulties. That's why it's so important to also make lifestyle changes that include regular exercise, a healthy diet, and sufficient sleep. Behavioral therapy, also known as behavior modification, has been shown to be a very successful treatment for patients with ADHD. It is especially beneficial as a co-treatment for patients who take stimulant medications and may even allow you to reduce the dosage of the medication. According to the American Academy of Pediatrics, there are 3 basic principles to any behavior therapy approach. First, set clear and specific goals for your child. Then, provide rewards when your child shows the desired behavior. Meanwhile, give your child a consequence when he or she fails to meet a goal. Finally, keep using the rewards and consequences consistently for a long time to shape your child's behavior in a positive way. For example, one intervention might be that a teacher rewards a child who has ADHD for taking small steps toward raising a hand before talking in class. The theory is that rewarding the struggle toward change encourages the full new behavior. Other than conducting behavioral therapy, psychoeducation can be helpful sometimes. Psychoeducation is defined as a process of providing education and information to those seeking or receiving mental health services, such as people diagnosed with ADHD and their family members. This enables patients and their family members to learn more about ADHD. Another non-pharmacological treatment is to change the child's lifestyles. The habits of making lists of tasks, using sticky notes, and breaking down heavy tasks can help to ensure the child's work being done in a more systematic way. Furthermore, one nutrition move that has shown to be effective is taking omega-3 supplements. Research has shown that children with ADHD have lower levels of omega-3 fatty acids in their blood than the typical child. As a result, children are recommended to take omega-3 supplements. The elimination diet cuts out artificial colorings, flavorings, and preservatives to decrease hyperactivity. While most scientific studies have disproved this theory, some parents who have tried it say they notice an improvement in their child's behavior. We hope you enjoyed this video and get some information about ADHD through this video. Thank you for watching. Bye bye!